Myeloma is one of the leading cancers that exhibits disparities between African Americans or individuals of African descent and individuals of other races. There are 2 to 3-fold higher rates of myeloma incidence as well as myeloma outcomes, poor outcomes, in individuals of African descent. And this is a major public health problem, but it also provides some interesting opportunities for us to understand both why myeloma occurs and why it occurs in some individuals, for example, individuals of African descent, compared to others. In order to do this, we need to better understand what kinds of risk factors there are that might be predisposing African descent individuals, African Americans, to myeloma. We know very little about the factors that are predisposed to myeloma in general. There aren't very many risk factors aside from some genetics. There are some knowledge of exposures, particularly environmental agents and pesticides, but also factors like obesity. We don't have much evidence that the genetics and the environmental exposures are substantially different by race. So it leaves us to think about factors like obesity that are clearly different in individuals of African descent compared to others. So we've begun to ask questions like, does obesity lead to increased rates of monoclonal gammopathies of undetermined significance, which is the precursor lesion for all of myeloma, and seems to be occurring at much higher rates in African Americans compared to other groups, as well as myeloma. So there's the precursor lesion, and the disease itself occurs at a higher rate in Africans who have a greater risk of obesity. So there's a lot of interesting correlates now that we've begun to put together, but the research is very early. The other piece is that we know that there are genomic patterns, signatures of disparity that might be associated with increased risk, or at least different progression patterns in African descent individuals compared to other individuals in the population. So we're beginning to exploit this to understand if there are patterns that we can use to predict early progression of disease, progression from MGUS to myeloma, in African descent individuals compared to others. And right now there is limited information, but we do have some information that suggests that these patterns differ and that they may interact or they may be compounded by factors like obesity or body habitus. If we can begin to identify these predictive factors, molecular signatures, risk factors, epidemiological risk factors, we may be able to come up with scores or other predictive models that allow us to understand who is really at risk and to understand why African Americans might have very high risks of cancer. The reason we can do this is because we can intervene in some of these people. This is because we now have effective treatments for many myelomas, for myeloma, that allow us to have a better outcome. But if we can begin to think about implementing this treatment earlier in the phase of disease, perhaps during the smoldering myeloma stage, we may have a better chance of heading off end organ damage, bone damage, and things like that. So the goal right now is to try to understand what molecular signatures, what epidemiological risk factors can be used to understand who is at risk, why specific African Americans are at risk, monitor those individuals through liquid biopsies and other molecular signature monitoring protocols, and then to bring people to treatment sooner or to intervention sooner than they ordinarily would have, and to avoid the end organ damage that might occur. The study that we're beginning to develop in order to address this question has recently been funded by the Stand Up to Cancer Dream Team initiative. So we now will have a very large cohort of individuals with MGUS, and they'll be oversampled for African American and other high-risk groups, and we'll be able to follow them over time and understand the molecular signatures and other epidemiological risk factors. So this study is very early, but hopefully it will allow us, along with other epidemiological data, to predict who's going to be at risk and to intervene to reduce myeloma morbidity and mortality.